Good afternoon. Welcome to Monday Reading Live. This is me, Vandana PS, joining you from Needu's Academy. How was your weekend? Was it all good? Okay. So did you all do additional materials in the last weekend? All right. So yes, as usual, we will be start with part B, a sample question. Then we will move to part A. Okay. First of all, I'll give you 2 minutes for the preparation of the first question, then we will discuss the answers. So here is the question. Yes, welcome back. So how was the question? Was it easy? Okay, so the question goes like, according to the extract, what is said about autism in children? So what are the keywords from the question? May I know what are the keywords from the question? Yes, Lakshmi and Marin, good afternoon. Yes. So the keywords, autism and children. Okay, so these are my keywords from the question, autism and children. Then what are the options? As you know, part B is all about multiple choice questions with 3 answer options, and there will be a paragraph. Okay, so either you can read the question first, then the answer options, then you can move to the paragraph, or you can read the question, read the paragraph and the options. Clear? So what about the first option? Autistic children cannot hear the sounds and are unable to talk with others. Option B, treatment for autism starts early. The child doesn't have any chance to recover completely. And option C, when they become an adult, all autistic people can live as actively as normal people. So what is the correct answer here? So before moving to the answer, let's mark keywords from the options also. Option A, what are the keywords from the options? Cannot, which means the children, they cannot hear the sounds and are unable to talk with others. Okay, so my keywords cannot, sounds, unable. And option B, treatment for autism starts early. The child doesn't have any chance to recover completely. So starts early as well as completely. And what about option C? When they become an adult, all autistic people can live as actively as normal people. So my keywords: adult, all, as well as normal. Okay, then now we are moving to the paragraph. So what is a paragraph? Autism spectrum disorder is a condition related to brain development that impairs social interaction and communication and causes restricted and repetitive behavior, all starting before a child is 3 years old. Okay, so nothing mentioned. Then the genetics of autism are complex and it is generally unclear which genes are responsible for it. Autism affects many parts of the brain, but how this occurs is also poorly understood. Autism is strongly associated with agents that cause birth defects. Other proposed causes, such as childhood vaccinations or vaccines, are controversial, and the vaccine hypothesis lack convincing scientific evidence. The number of people known to have autism has increased dramatically since 1990s. Parents usually notice signs in the first 2 years of their child's life. Early behavioral cognitive intervention can help children gain self-care, social and communication skills, but there is no cure for it. See that line? Okay, so we can, which means early behavioral cognitive intervention can help children gain self-care, social and communication skills, but what is the problem? But there is no cure for it. Okay, few children with autism live independently after reaching their adulthood, only few children. But some become successful and an autistic culture has developed, with some seeking a cure and others believing that autism is a condition rather than a disorder. So which options can be eliminated? So we are using elimination strategy or elimination method in part B. So how can we eliminate the options? Okay, option A is all about autistic children cannot hear sounds. So nothing mentioned about they cannot hear sounds in the para. So we can eliminate option A, not mentioned. What is the reason we are eliminating option A? Not mentioned. And what about option B? Treatment for autism starts early. Yes, early behavioral cognitive intervention is there. The child doesn't have any chance to recover completely. Why? Because they can help children gain self-care, social and communication skills, but there is no cure. Okay, so maybe option B is the correct answer. What about option C? When they become an adult, all autistic people, see, it's not about all autistic people, some children, okay, or few which means something, few which means no, a few which means some. So here, no children, okay, with autism live independently after reaching adulthood. So that is wrong. And one more thing is there, question is asking you regarding children, not about adults. Okay, so these are the reasons we are eliminating option C, contradictory option, or we can say opposite option. So our answer is option B. That is the correct answer. So it is paraphrased. Where is it paraphrased? What do you mean by paraphrasing? Which means the same meaning is here but different sentence, entirely different sentence structure. So answer is option B. I hope it is clear, right? Any doubts? A lot of correct answers, okay? Yes, Yogeshwari, Divya, yes, Binida, good afternoon. Reshma, good afternoon. Yes, Lakshmi got the correct answer. Marin, Reshma, Reba, Ashwati, Tessie, yes, Jinu, yes, good afternoon, Jinu. Jisna, okay, very good, excellent. So you all got the correct answer. Excellent, guys. So now we are moving to the next part, that is part A. So we have a new material, Alpers disease. Okay, so before moving to part A, let me summarize something regarding part B. So what do you know about part B? I'll start with the time. So out of the 60 minutes, you will get almost 10 to 12 minutes for the completion of part B. Okay, not more than that. Then, within this 10 to 12 minutes, we have to complete 6 questions. As I already mentioned, 6 questions will be in the form of multiple choice questions with 3 answer options. Okay, so either you can read the question, then read the options, then the paragraph, or you can read the question, then the paragraph and the options. And the strategy is all about elimination method or elimination strategy. Okay, and you will not get the exact direct line from the paragraph into your answer option. That will not be the answer. Okay, maybe they will mention the exact line from the paragraph into your answer, into the options, but still it will not be the correct answer. 95% I can say it will not be the correct answer, because part B is all about what? Paraphrasing. So what do you mean paraphrasing? Once again, paraphrasing is all about the same exact meaning but different, entirely different sentence structure. Okay, so that will be that. Then out of these three options, one option will be not mentioned, one option will be contradictory, and we have a correct answer. Okay, we will have a correct answer, yeah. Okay, so it can change accordingly according to the questions. Hope it is clear. Hi Nebi, good afternoon. Yes, Samu, good afternoon. Yes, I'm good, dear. How was your weekend? Okay, now we are moving to part A. Yes, so what do you know about part A? So every day, every live sessions are like revisions, right? Yes. So part A, again I'll start with the time. Out of the 60 minutes, you will get exactly 15 minutes for the completion of part A. So only after the completion of part A, they will provide you with part B and C materials. Okay, so within this short period of time, we have to complete 20 questions. And these 20 questions will be categorized into 3. So the first set of questions can be called match the following questions, 1 to 7 set of questions. Then 8 to 14, those are called short answer questions. And the rest of the questions can be called fill in the blanks. Okay, so that is all about the category of questions. And what about the strategy? So what strategy we are using in part A? Yes, what strategy we are using? Any idea? What strategy in part A? It's all about skimming and scanning. So what is skimming and what is scanning? Okay, so skimming, which means fast reading or speed reading, whereas scanning, which means we are searching for some important words from the text. Okay, so why we are applying this technique? Any idea? Any other method you know? Other than skimming and scanning, do you have any idea regarding the strategy? Any other strategies you have? Let me know in the comments. Other than skimming and scanning, what type of strategy you guys are doing? Okay, coaches, yes, skimming and scanning. Okay, Shuri, skimming and scanning. Ammo, skimming and scanning. Yes, Reba, searching important words. Okay, Tessie, fast reading. Okay, so as I was always saying, you can read whatever you want, right? Okay, if you know the language, if you know the words, if you know the sentences, letters, we can read whatever you want. But there is no connection with what? Thinking process, or there is no attribution to cognition. So what is cognition? You have to think about it, right? So yes, here fast reading plus searching for the important words. So when you search and when you catch the important words, you will get an idea. Okay, so these are all the important words from that particular text. Okay, so the type of text, yes, we have 4 different type of text. Text A, text B, text C and text D. Okay, it will be entirely different from one another. And one text will be a pictorial of something. Clear? Yes. Okay, fast reading. Okay, Marin. Okay, Marilyn, yes. Hi. Sonia, okay, skimming and scanning. Yes, it's all about skimming and scanning. So this is the only method that will help you to locate your answers within this 15 minutes. So what we are going to do here in part A is all about locating the correct answers from these texts. Okay, so now we are moving to this particular new material, Alper's disease. Okay, so I'll read and underline the keywords from the text. So let me know in the comments from text A, what are your keywords? And after marking the keywords, I'll tell you what are the important keywords. Okay, yeah. So let me know what are the keywords from text A. Any idea what are the keywords that you guys will mark from text A? Yes, Amu, Marilyn, Reba, Sonia, any idea what are the keywords from the text? Okay, you guys can read it along with me. Alper's disease. So first of all, we are marking the name of the disease condition, which is Alper's disease. Is a rare mitochondrial disease that affects your brain, liver and muscles. Okay, mitochondrial gene. Okay. Then a change, which means mutation in gene. Yes, the name of the gene, which is mentioned here in brackets. Children inherit these genes mutations from both of their parents. Then defective POLG1, okay, POLG1, P-O-L-G, genes that come from both parents cause Alpers disease. Then Alpers disease is a type of mitochondrial disease. The defective genes cause mitochondrial DNA to not work as well. Alpers disease affects your brain, liver, muscles the most, since these organs need a large amount of mitochondrial energy to function. Some researchers think that environmental factors such as virus may cause people who have inherited the defective genes to develop the disease. Then 1 out of every 1 lakh people has Alpers disease. People with Northern European ancestors have a slightly higher incidence. Other names for Alpers disease include Alpers-Huttenlocher syndrome, then Alpers syndrome, diffuse cerebral degeneration in infancy. So these are other names. So my keyword from the paragraph is Alpers, POLG1, then parents, children, then DNA, the number 1 lakh, then the country Northern European, as well as other names. So these are my keywords from text A. So what about you? Okay, mitochondrial gene, POLG1, rare, DNA 1 lakh, okay, DNA, Northern European, other all names, okay, POLG, DNA gene, other name, 1 lakh, environmental factors, Northern European. Very good, excellent. Okay, so we are moving to text B. So now tell me, what are your keywords from text B? What are your keywords from text B? Okay, so first of all, I am marking the heading, signs and symptoms. Okay, I'm 1 lakh and Northern European. Very good. Then from text B, what are your keywords? So signs and symptoms, I'm just reading seizures. Okay, then liver disease. Then slowing down of thinking, I'm marking just the brackets, mild cognitive impairment and lessening of movements. Together providers call these symptoms psychomotor regression. Then other symptoms may include anxiety, depression, brain, then hypoglycemia, then thrive, okay, migraine headaches, hallucinations, muscle stiffness or spasticity, muscle twitching, then Alpers disease progresses. Okay, symptoms may include blindness resulting from optic atrophy and difficulty swallowing or dysphagia, dementia, then cardiomyopathy, then ataxia, gastrointestinal diseases, loss of control, arms and legs, okay, spastic quadriplegia, then cerebral palsy, then cirrhosis or liver failure. Okay, so these are my keywords. Already, some technical glitches happen. So once again, I'm marking the signs and symptoms. Liver, yes, the brackets, anxiety, brain, hypoglycemia, migraine diseases, headaches, then spasticity. Okay, so these are my keywords. So yes, what are your keywords? Okay, Reshma, signs and symptoms. Yes, very good, dear. Then mutation, Sonia. Okay, from text A, right? Okay, then all signs and symptoms, bracket words. Okay, Reba, signs and symptoms, refractory epilepsy. Okay, Sonia, very good. Then bracket words also. Okay, Ammu, yes. Okay, that's all about the bracketed words. Yes. Okay, then we are moving to text C. It's all about clinical assessment. Okay. Clinical assessment. So, healthcare providers usually diagnose Alpers disease by looking for the main symptoms of dementia, liver disease and seizures. So, I'm just marking dementia, liver and seizures. All about clinical assessment, right? That is a heading. Other tests may use to confirm the diagnosis include cerebrospinal fluid analysis. Just I'm marking all the methods, genetic testing, MRI. Okay. So, then now we are moving to, so what about text C? Okay, clinical assessment, CSF, EEG, genetic testing, MRI, diagnosis. Very good, excellent, Reshma, yes. And what about text D? There is a diagram. So it is all about identification, screening, eligibility, and what are the other factors included. Okay, there are a lot of numbers mentioned here, even though this is a very small, okay, tables, it's very important. Okay, so 738, 136, 6 and N880, then number of patients, that is 2, 824, then POLG, okay, as well as 8, 42, 866, then So that is all about text A. Always give a close look to small tables. Definitely they will ask questions from those small tables. Okay. Okay, Amu, yes. Diagram, clinical assessment. Yes, yes. Okay. So now let's move to the first set of questions, which are match the following. Okay. So before moving to the match the following questions, what are the important keywords that you can mark from text A? Sorry, part A. So what are the keywords? And you guys know a set of 13 keywords, which I've already told you from the previous past lives, right? Okay, so now tell me, what are the keywords, important keywords? May I know what are the important keywords that you guys will mark when you read each of these texts? What are the important keywords? Okay, Tessie, heading and subheadings. Then numbers, very good. Then fourth one. So heading, subheadings, numbers, very good, excellent. What about the fourth one? Any idea? I just want to know, okay, I'm just bit curious about knowing that. Who know these 13 keywords, that proper structure, okay? The proper order, I can say, yeah. Can anyone please comment what are the 13 different keywords that you can mark? Okay, heading, subheading, numbers. Okay, brackets, bullet points, signs and symbols. Okay, yeah. Then names, very good, Binida, yes. So I think almost 10, right? 10 keywords. What about the rests? Okay, brackets, heading, subheading, numbers. Okay, Amu. Then what else? What else? We need to underline the question. Okay, it is all about the question part. I am just asking you regarding what are the keywords that you will mark from the texts, from each of the 4 texts. Names, research, okay. Okay, Tessie, yeah. Then. Okay, Sony, first sentence and last sentence. Okay, I will not say that you have to mark first sentence and last sentence of each and every paragraph. Just give a special focus to all the first and last line of each and every paragraphs. Yeah. Okay, names and short forms. Okay, Ammu, yeah. Words indicate time. Excellent. Very good, Reba. Yes. Symbols. Okay. Okay, Binida. Yes. Then anything else, you know? Capital letters. Okay, Ruby. Okay, I'm so sorry that I'm not agree with capital letters, okay? I have no idea what you mean by that, capital letters. Italicized letters and bold letters, yes, excellent, yes. Okay. Okay, so now it's all about, you can mark all the headings. Subheadings, numbers. Okay, maybe they will give the numbers, as I already mentioned, maybe in figures as well as in words. Whatever it is, if it is a number, mark all the numbers. Fourth one, what? Signs and symbols. Okay, so what is an example for a sign? Greater than is a sign, less than is a sign, equal to is a sign. So percentage is a symbol. Okay, then what about the fifth one? Names. You can mark all the names mentioned in each of the 4 texts. Maybe name of a person, name of a disease condition, name of a country, name of an instrument, okay, name of a test. Whatever names, pronouns I can say, they mentioned, mark all the names. What about the sixth one? We have to mark all the things which are mentioned in abbreviations, short forms. Okay, so for example, here you can see a lot of short forms. Example, I can say what? See, MRI, EEG. So likewise, mark all the abbreviations. Then the next one, mark all the brackets. It is very important to mark all the brackets. That is the 7th one. What about 8th one? The words that indicate time. Okay, the words that indicate time. And before that, there are words that indicate, italicized or bold letters, bold words. Okay, then you can mark the words that indicate time. Now, currently, presently, previously, before, after, okay, during. So a lot of words that indicate time, as well as the words that indicate research, okay, administration, population, study, approach, Okay, the word itself, research, researcher. Okay, then the words that indicate experiment, diagnosis, ascertain, identification, test. Okay, clinical observation. Likewise, all the words that indicate what? Experiment. Then the words, yes, you guys know, you can read the first line and last line of each and every paragraph as well as all the bullet points. Okay, clear? So this is how you guys are gonna read each and every text. Okay, so coming back to the first question. For each question 1 to 7, decide which text. See, here you don't have to answer, okay, which is the correct. For example, a procedure that plays metal disc. You don't have to write the name of the procedure here. Okay, it is not short answer question. It's all about match the following. So you guys are just locating the answer and find out in which test the answer is lying. Okay, so the procedure that places metal disc on your scalp to look at your brain activity. So my keywords: procedure, metal disc, then brain activity. So any idea? Yes, Nimisha, Sebastian, yes, timings. Okay, Sonia, clinical observation. Okay, Ruby, short forms, very good. Bullet points, Anu. Okay, Reba, yes. So what about the first question? Any idea? What is your answer? A procedure that places metal disc on your scalp to look at your brain activity. Okay, hi Megha, good afternoon. Yes, dear. Okay, Tessie, Liji, Amu. First question, answer is text C. How it is text C? Okay, it's all the procedure, it's all about clinical assessments. So we can do a lot of procedures here: cerebrospinal fluid analysis, electroencephalography, EEG, then genetic testing, magnetic resonance. So it's all about electroencephalography. So what is mentioned here? Okay, see, they place metal disc or electrodes on your scalp to look at your brain activity. So that answer is from text C. So your answer should be C. Then second question. The method would be efficient to detect the enhanced level of gray matter in response to Alpers disease. So my keywords: method, efficient, then gray matter. Okay, so what about that one? Second question. Oh, a lot of correct answers. Okay, maybe Amul, Liji, Tessie, Nimisha, Benita. Second one is also from, very good, text C. Why? Again, they are asking about a method, a procedure. Okay. Yeah, again a procedure, method. So would be efficient to detect enhanced, increased level of gray matter in response to Alpers disease. So that is all about another one. Okay, so what is it? It's all about MRI they are mentioning. MRI of your brain will show an increased mass of gray matter, which means enhanced level. Of course, that is from C. Very good. Third one. Okay, Leah, Nimisha, okay. Then the nature of migraine headaches in Alpers disease. So my keywords: nature, migraine, headaches. Yes. So where they have mentioned about migraine headaches. Any idea? Nature of migraine headaches. Okay. I can say migraine headache, which means it is a sign, or I can say a symptom, right? So definitely which comes under signs and symptoms. See, migraine headaches with hallucination. Okay, so the answer should be text B. So you can write third one B. Fourth one, how many additional records got identified through other resources? Other sources. So how many? Then records, other sources. So what is your answer? Fourth one. Yes, Reba, very good. Signs and symptoms, which is from text B. Very good, Benita, Reba. Okay, Tessie, Binsi, excellent. So what about fourth one? How many additional records got? Excellent, Tessie. That is from text D. Okay, so where they have mentioned? So if you guys are checking your additional materials, you can see that there is an order. Okay, maybe text A is all about that particular disease condition. For example, if it is about dementia, or if it is all about dermatitis, okay, text A will always be about the explanation, what is dermatitis, what are the signs and symptoms, about the prevalence maybe. Okay, and text B, maybe it is all about symptoms, signs, or about the medications. And text C is all about, maybe there is a comparison or a diagram regarding something, about the test or something. And text D is all about the result, outcome, measures, okay, studies. So likewise here it's all about the study, text D. So here they have mentioned regarding what? The study. So that is from text D. Then fifth one, the role of heritability in development of Alpers disease. So my keywords, heritability, development. So what about fifth question? Any idea? The role of heritability. It is up to the parents, right? Yeah, heritability in the development of Alpers disease. Yes, as you can see here from text A, they have mentioned the heritability. Okay, very good. It is a mutation. So it's all about children are inheriting the disease condition, right? Okay, Tessie, Reba, Nimisha, excellent. That is from text A. Then sixth one, the first and foremost symptoms. Again, they are asking you regarding the symptoms. So direct answer, text B. And what about seventh one, alternative names of Alpers disease. So yes, already we have marked the keywords regarding the names. So what are the alternative names? Where is it mentioned? Very good, Liji. Yes, Reba, Tessie, Nimisha, it is from text A. Okay, all about alternative names. See, other names, alternative names. Very good. So that is all about 1 to 7 or match the following questions. Any doubts regarding these questions? Clear? Okay. So now we are moving to 8 to 14 short answer questions. So what is the important instruction? You can write it in a word or a short phrase. So a phrase which means, okay, number of words, maybe 3, 4, 5, lot of words. But short phrase which means maximum 3 words. Okay, so 8th one, total number of records excluded on the basis of title or extract. So total number, then records. Okay, so the records mentioned, as you know, that is in text D. So what is the total number of records? Any idea? Okay, so total number of records excluded, right? Yeah, excluded. So that is from text D. See, records excluded based on title or abstract. That is 824. 824 should be the answer. Okay, so that is 824. 9th one, the descendants of which nationality might have a higher chance of Alpers disease. So my keywords, descendants, nationality, okay, as well as higher chance. Okay, Juby, that is 824. Yes, correct, dear. So what about 9th one? The descendants of which nationality? 9th one. Okay, so the nationality which is only mentioned in text A, that is Northern European is the answer. Ancestors already mentioned in the question. Yeah, answer is Northern European. Yes. Okay. Then 10th one. Okay, Reba, it is Northern European. Tessie, Northern European. Binsi, Juby, yes, Northern European. Very good. Okay, yes. Hi. Yes, hi, good evening, Claudine. Yes. Then 10th one. The insufficiency of which component may get identified through the evaluation of cerebrospinal fluid. So my keywords, insufficiency, component, then okay, cerebrospinal fluid. So where they have mentioned about cerebrospinal fluid. Okay, so which is mentioned in text C, as you can see here, cerebrospinal fluid analysis. Your provider collects fluid from your lower back with a spinal tap. They test the fluid for cerebral folate deficiency. So the answer should be cerebral folate. Okay, which is from text C. Answer should be cerebral folate. Okay, then 11th one, a type of cerebral palsy defined as the loss of control of arms and legs. Okay, so what is your answer? 11th one. Okay, any idea? 11th question, a type of cerebral palsy. So where is it mentioned? Maybe it is all about the signs and symptoms, right? Type of cerebral palsy. Okay, so here, loss of control of arms and legs. So those are the keywords from the question. And cerebral palsy is already mentioned. So what is the correct answer? Spastic quadriplegia. Answer should be spastic quadriplegia. Okay, so that is from text B. Very good, Reba. Yes. Then, 12th one. Which condition precede blindness in Alpers disease? So, name of the condition. Which condition precede? Before, it can occur before blindness in Alpers disease. So, which condition? Any idea? What is the name of the condition? Okay, maybe conditions mentioned again in text B. Any conditions mentioned here? Okay, any idea what is the correct answer? Any idea? It is related to blindness. So, blindness resulting from optic atrophy. So, answer should be optic atrophy from text B. Okay, now we are moving to the 13th one, the tests used to evaluate increased amount of grey matter with Alpers disease. Already we know that test is already mentioned in C. Okay, regarding the grey matter. So that answer should be MRI or magnetic resonance imaging. Okay, yes Anu, MRI. Okay, Riba, MRI, Megha, Reshma, very good, excellent, MRI. Okay, yes, Jubi, Jansi, yes, MRI. Okay, then 14th one. Okay, Binida, Tessie, Liji, okay, a lot of correct answers. Okay, Divya, MRI, very good. Then, which mutated gene? So, where they have mentioned about genes is responsible for the occurrence of Alpers disease. So, what about the name of the gene? Okay, it's all about a change or mutation in gene POLG1, POLG1. So, answer should be POLG1 or POLG1. Okay, then the next one. So, that is all about 14. So, now we are moving to the next set of questions. Those can be called fill in the blanks. So, the same word or a short phrase. Okay, 15th one, yes. Okay, Megha, Merlin, Ammu, Tessie, Binsi, it is POLG1. Yes. Okay, Anu, POLG1. Yes. Then 15th one, the absence of dash as well as proven POLG mutation led to exclusion of full text screened articles. Okay, so absence of dash. So what is the correct answer? Absence of what? What is mentioned there? Okay, so from text D, absence of, see this particular text, full text screened articles excluded 824 patients, and reasons for exclusion, example, not proven POLG mutation, as well as no diets intervention. Okay, so answer should be no diets intervention. So that is the correct answer. Okay, no diet intervention. So answer should be diet intervention, because already absence is mentioned in the question, right? So you can write absence of diet intervention. Yeah. Okay, Jubi, Tessie, very good. Diet intervention should be the answer. Okay. Then 16th one. Some researchers think that dash such as a virus may cause people who have inherited the defective genes to develop the disease. So what is the correct answer? Some researchers think that dash such as a virus. Okay, so what is the correct answer? What can cause this particular disease condition? Environmental factors. Some researchers think that environmental factors. So what are the missing words? Environmental factors. Okay, so that is the correct. Very easy question. Yeah. And the next one, In dash, the providers will make use of the blood samples to examine building blocks or sequence of your genes from or for mutations. So my keywords, providers, blood samples, then genes. So what is the correct answer? In dash. They are talking about a particular test maybe. Okay. So yes, your provider will take a blood sample from which one? Through genetic testing. So answer should be genetic testing. Okay. Yes, mega genetic. It's not genetic sampling dear. It is all about genetic testing. Okay. Yes, Tessie, 𝐉𝐶, okay, Juby, Merlin, genetic testing. Very good. Okay. So 18th one. The two other main symptoms, okay, main symptoms such as liver disease and slowing down of thinking and lessening of movements are together called dash. So together called what? Any idea what can be called? It is from text B. Okay, the symptoms. So together it can be called. Okay. So together that can be called, providers call these symptoms psychomotor regression. Answer should be psychomotor regression from text B. Together providers call these type of symptoms symptoms psychomotor regression. So answer should be psychomotor regression. Okay. Then the next one, 19th one. Alpers disease affects your brain, liver and muscles the most since these organs need a large amount of dash to function. So what is the correct answer? It affects your brain, liver, muscles and need a large amount of dash to function. So what to function? Okay, see, what to function? It needs, see the second one. Alpers disease affects your brain, liver and muscles the most since these organs need a large amount of mitochondrial energy to function. So answer is mitochondrial energy from text A. Okay. And the last question, 20. Healthcare providers usually diagnose Alpers disease by looking for the main symptoms of dementia, liver disease and dash. Okay. So answer should be one of the symptom and that is all about seizures. Okay, so that is all about seizures and that is the correct answer. Okay, clear? Any doubts? Any of the questions? I hope it is clear for everyone. Okay? Yes. So anyone got 20 out of 20? May I know your marks? Okay, Madeline, Juby, 𝐉𝐶, Tessie, Meka. Any 20 out of 20? Most welcome, dear Reshma. Yes. Okay, Reba, 20 out of 20. Okay, most welcome, Jansi. Okay, 20 out of 20. Very good, very good. Excellent. Okay. So, yes. If you have any doubts regarding this, you can comment it. Okay. Definitely, I'll reply to all of your comments. So, stay tuned. Let's see with another new topic tomorrow. Okay. Thank you. God bless you all.